Opioid overdoses have become one of the deadliest public health crises in U.S. history, causing over 80,000 deaths each year. Baltimore has been hit especially hard. Between 2006 and 2019, more than 500 million opioid pills flooded the city, contributing to a surge in overdose deaths. Experts say over 80% of opioid addiction cases in Baltimore from 2010 to 2021 began with prescription drugs, which often led people to turn to illegal opioids. Although Baltimore makes up just 9% of Maryland's population, it accounted for 44% of the state's overdose deaths through the first 7 months of 2024. On average, the city sees more than 2 overdose deaths per day. To hold pharmaceutical companies accountable, Baltimore filed lawsuits in 2018 against manufacturers and distributors for fueling the crisis by failing to control the distribution of addictive opioids. The city chose not to join a nationwide settlement that offered less compensation, and instead pursued its own legal action. Here's a glimpse of Damon Marshall, owner of Nuwave Health Services, attended a hearing to review how opioid settlement funds are being used and whether they're truly helping Baltimore's hardest-hit communities.
Next, we're going to hear from Damon Marshall. You have 5 minutes.
Good morning.
Good morning.
Last Thursday's overdose incident came a day after the Office of Overdose Response held its first community meeting, which looked to get thoughts from members of the community on how to use millions of dollars in settlement funds. I attended that meeting, and I found it to be a step in the right direction. But personally, I didn't leave the meeting feeling any different about the opioid crisis than before I came. Although the meeting seemed helpful, I couldn't help but leave there feeling disappointed because decisions have already been made and the bulk of the funds had already been allocated. The mayor speaks about being transparent and how things will be different this time, but yet the funds were allocated to the same people and organizations that have been receiving the funds from City of Baltimore for a very long time, with not much happening from them. It would have been refreshing to know that some of the money was allocated to a few of the newer or different community leaders, treatment programs, or nonprofit organizations who are really making an impact in the community. This would have showed that they are indeed researching and trying to find the best possible options for the opioid crisis instead of going with the status quo. I hope that my feelings are wrong. I say this not to say that the initiative was not an important one, but to highlight that it's not impactful enough for the crisis that we are facing. I spoke with many members of the community, and they are skeptical of the promises that are being made. These same promises have been made time and time again with no results or outcome. It's been years, and there hasn't been any significant investment in the community. And I think our leaders have underestimated the community's awareness of these unfulfilled promises. I think the overdose strategic plan is a good start. Although it's true that members of the community want to be heard, and they are thankful for the opportunity to share their feelings on these issues, but more importantly, they also want to be led. I think this is where the frustration between residents and our political leaders stems from. Many residents of Baltimore feel they elected government officials into office to protect them and their interests, and the elected government officials have fallen short. Because to them, many of the problems have not been addressed. They don't feel enough is being done by lawmakers or the police department. These are the people they trusted to provide solutions with smart decision-making and critical thinking. The opioid and mental health crisis is a complex one, and there is no one step or one answer approach. But I myself have a few questions. Maybe they can get answered today or taken note of and answered at a later time. So here are a few of my questions. Are the funds strictly for the prevention and treatment of opioid overdoses only as it pertains to treatment centers? If not, will a portion of the funds be used to try and reduce the crime associated with the opioid crisis? How much of the funds, if any, will be allocated for the actual prevention of drugs coming in to our communities, which would lead to more investigations and dismantling of the pipelines of fentanyl trafficking? Will the funds lead to more police on the streets, more funding for building up the infrastructure, which would increase the lighting in some areas, neighborhood trash removal with piles of trash being used as stash spots and cover-ups for the dealers' drug inventory? Will the funds be used to improve real estate and home ownership in the communities by fixing and selling of abandoned buildings that serve as drug hubs for people who suffer from substance abuse disorders? These are just a few of the things the community actually needs. Although they are important, we don't need more promises of recreation centers at this time. We don't need more promises of festivals and ice cream giveaways in the communities at this time. That ship has sailed. These things just sugarcoat the real issues that have plagued our community for decades. The times when those things were a real part of the solution has passed. We have entered a time and space when more severe strategies are needed. We need a more aggressive approach. Promises of hope, promises of investments, promises of safety and security, promise of better treatment in healthcare facilities, promise of a rebuild and revitalization of neighborhoods. These are the promises that are vital for our community to thrive and succeed. And they have to be carried out and delivered expeditiously. Thank you for listening. I'm
Thank you.
Damon Marshall, CEO of Nuwave Health Services.
Thank you
Thanks.
so much.